Uh,
Should we kick this thing off?
yeah, Colton, what questions do you have before we dive in?
I don't think any. I mean, I think we should probably give a disclaimer that I'm not a men's health expert.
We'll give maybe some disclaimer not to
This isn't
all
real
the
medical
advice you receive.
advice.
Yeah.
Yeah, that'd probably be good.
I don't know what you're talking about. You've been a man your whole life.
Uh-huh. Yeah, no, that's fair.
What's up, everybody? Welcome to another episode of What the Fuck Do You Do? I'm your co-host, Shrey Bay Bay. We got T Foxy Trav, Justin Jawong Dong, and we're doing a real special episode today. We're doing Ask a Doctor today, and we are joined by our friend, Dr. Colton. Doctor,
Hey, thanks
how
for
are you?
having me. I'm good, guys. Thanks for having me.
How's it feel on the pod?
I mean, amazing. I've been asking to be on the pod for a long time, but now I feel a little nervous.
Well, don't be. We're going to ask you some really tough medical questions, but you've got the answers, so.
Hey, as a new fan of the pod myself, Trey, would you say that you are the host? Because I've always kind of assumed that.
No, co-host.
Co-host. All right.
You're kind of like the guy, though.
Yeah.
No. We're in this together.
You're kind of the face. You yell the intro, it's a pretty big deal.
Yeah.
You'll be Jordan, someone's Scotty, and I'll be
Jerry Krause.
And I'll be Jerry Krause.
Just pulling the puppet strings. Okay. So, Colton, before we get into asking you a bunch of questions, can you just give us a little intro about yourself? Like, what kind of doctor are you? Like, what is your background in the medical field?
Yeah, good question. This is a question I typically avoid at weddings and things because most people haven't heard of the field that I'm in, and a lot of old people then instantly try to tell me about their chronic knee pain. But in any case, so I graduated medical school in 2020, right into the pandemic. So when you graduate medical school, that's when you get your medical degree or become a medical doctor. So I'm an MD and have been for going on 4 years. And then my residency is in physical medicine and rehabilitation, which is essentially kind of a mix of non-operative orthopedics and neurotrauma. So it's a lot of hospital-based medicine. We take care of patients who have stroke, spinal cord injury, traumatic brain injury. And then in kind of like the clinic setting, we see a lot of chronic musculoskeletal problems, primarily back pain, knee pain, shoulder pain, those types of things. So it's kind of a diverse field. A lot of people do quite different things coming out of it. But in 3 or 4 months, I'll be kind of board eligible. And that's when you can say you're a board certified physiatrist or physical medicine and rehab doc.
Okay. I also had to ask because I saw that word physiatrist and I didn't know how to pronounce it.
Yeah. So supposedly some people around the country pronounce it differently, even within the field. So I think you can just butcher it however you want.
Okay. Love that.
You misspelled psychiatrist. I'm like, dude, he doesn't even know what kind of doctor he is.
Yeah. It's the most common is, oh, so you're a physical therapist. And that's, like, no, I went to medical school, but I work closely with them and we treat a lot of the same things, but we're medical doctors. So we prescribe medicine and read MRIs and those types of things.
So what is like a day-to-day look like for you as a doctor right now treating patients?
Yeah, good question. Early on in training, it was a lot of hospital based. So I'd be on an inpatient rehab unit. So someone gets hit by a car, has a spinal cord injury and is, paralyzed from the waist down. They might go to a rehab facility that's hospital based, meaning you're spending the night there. And we take care of all the medical aspects of their care. As you move through your training, you move a little bit more towards outpatient typically, which is clinic based, which is what people are typically a little bit more familiar with. So this is, you make an appointment with a doctor, you come in and said, hey, I was in a car accident, my back hurts, and, we go from there. So right now it's a lot of kind of more clinic based hours and just evaluating patients day to day. And then as part of residency, we take, call, which is essentially where you have a pager or a phone all night throughout the week, and any problems that arise at the hospital kind of at any time of day come directly to you. So thankfully there's been less call it's as in like anything in medicine is a little bit punitive, since so when you're early on in your training, you take a lot more, and I'm kind of coasting at this point, which is really nice.
That's nice. Did you choose this field, by the way?
Yeah. So at the end of medical school, there's a match process, and you basically you pick your desired specialty, you interview around, and you put into this giant computer database your preferences, and then everybody fills up in auditoriums across the country on the same day and finds out where they're all going. So it's kind of an interesting deal because you make all these friends in medical school, and then inevitably people get shuffled around the country kind of at random. But yeah, no, I did pick the specialty.
What were your top choices?
Yeah.
What else was in the mix?
There are people who like put different specialties into their match list so that it's truly like a sorting hat. Like you find out what kind of doctor you're going to be on match day. Most people have already decided, and they're just picking where they're going. I considered really several things. I mean, I considered orthopedic surgery, I considered neurology, some family medicine. But ultimately this one kind of fit what I wanted to do the most.
Those seem all very different. Like,
yeah, they are
wildly different.
Yeah, I was having regular life crises because people talk about these things as if it's a calling, as if like there's one specialty and you were born to be a neurosurgeon. And I just didn't find that to be true. And I like different aspects of different things. And, it's, you're signing up for a really long time. Orthopedic surgery nowadays, most people do fellowships. And so you're talking about 7 years of training before you get to decide where you're going to live and what you're going to do with your life. And you're at the absolute mercy of wherever you go. And so trying to project out what life was going to be like as a 24 or 25-year-old and trying to think what my life might be like as a 33 to 35-year-old was pretty daunting. And so that kind of went into it a lot, like, hey, I like the OR right now, but I'm going to want to be here at 2 a.m. when I'm 35. I don't know.
So after 7 years of school and being on call and getting shuffled around the country and taking OChem and all sorts of other terrible things that have been involved in your life, like, do you think being a doctor is worth it? Like, is it worth it to you? Like, is it worth it? Is it something you'd recommend?
Do you like it?
Yeah.
I feel like you've asked me this like multiple times when we've hung out. I've gone through times where I have really, really disliked it. And I've gone through times where I would have definitively said, no, it's not worth it. I don't know that I'm in a spot like that right now. It's probably just my schedule is a little bit better and I'm doing a little bit more of what I like to do. And so I think a lot of us have short memories for those types of things, for bad parts of our job life and stuff like that. But it's a really long road, and you give up a lot of flexibility for having that like well-designed path. So like out of college, it sounds great because you're like, I just got to keep punching this number and going down this pathway for however many years. And at the end of the road, there's this high paying, reputable job where people want to hear what you have to say and you get to help people. But, I don't know many friends who started at 22 in the exact same job that they're in right now. And so once you get 2 years in and you start to think, maybe I don't really like this, or maybe I don't like dealing with people on their worst day, or maybe I don't like seeing all these old, smelly people, or kind of dealing with problems that are like oftentimes societal problems and not anything that you can change. Like I can't change food insecurity on a daily basis. And yet you see the downstream issues from those things every single day. So I think those things wear on you. And and I've been pretty open with this with my other co-residents, but I had a point in residency where I genuinely considered quitting. And the number one question everyone asked was, what would you do? And I had no idea. I feel like very separated job wise from everyone else. And I wouldn't even know where to start. And that was part of the reason to stay in. Just, maybe keep your head down and keep going. So I'm enjoying it a lot more now, but that's certainly a loaded question.
Yeah.
I can imagine it's always difficult too, like when you're trying to figure it out and people are constantly asking you, and it like that question just seems like a lot more daunting.
Yeah, exactly. I also just think there's this false thing that people have where like they consider medicine this calling, like it's not allowed to be a job, it's a higher purpose. And like sometimes you got to just go to work and sometimes you don't like going to work. And when you put this big weight on it, like, oh, do you not like going to work because you're not meant to be a doctor? Like that's a lot.
Well, I also feel like it's one of those fields where people think you want to talk about it all the time. Like if Justin goes to a party in New York, people aren't asking him like what he did on the DocuSign deal like 2 months ago. But if you go to a party, everyone's like, look at my rash. Like, what do you think it is? Like, you're a doctor.
Right. I hope no one's showing me their rash, but exactly. Yeah. And especially people over the age of 60. Like it's not so bad amongst our friends. And most of the time I kind of get excited to try to help someone that's in our age bracket. But man, like family Christmases with the in-laws, you get that like second uncle twice removed who wants to tell you about every single time he's had knee pain. And you're like, oh man, that's too bad, but I don't care. I'm sorry. my
Got checked
my
out.
my tank is empty. You should see a doctor about that probably.
Yeah.
It's kind of like when I studied engineering and Travis's mom always asked me to come build stuff at her house. Like,
You're an engineer, Shrey.
I don't know how to actually do that. You should hire a contractor.
You did fix things for her. That was the problem. You're just nice.
The nature of the problems were like my iPad and iPhone weren't syncing on the iCloud.
Colton, I
Okay.
am curious though, when we talk about calling, right? Like medicine should be people's calling, or that's what you hear. Did you always know you wanted to be a doctor from when you were a kid? Like when did that become an option for you?
Yeah, that's interesting. I remember being in high school. Oh, well, you guys can relate to this. Do you remember Woodruff's class senior year?
Of course.
Yeah.
No. Yeah. Well, I mean, like this guy definitely did some form of hallucinogens in the 70s and was like vaguely religious. And I think the class itself was like a religious studies class, but we never talked about religion, hardly
Yeah,
ever.
It was theology, but comparative theology. So we just learned about all sorts of cool stuff.
Right. And he would just like show YouTube videos of people high diving into the ocean and stuff and be like, how does this make you feel? And you'd be like, I don't know. But I remember writing a paper about thinking that I wanted to help people and I thought like medicine made the most sense. But I got into college and started these kind of pre-med classes and was like, well, if this is what it's going to be like, then this is awful. Like, I obviously don't want to do this. So then I, did what everyone and their mom was doing at the time and was like, well, I'll get into finance because that sounds cool. And I remember emailing, like I found some connection to a guy at, I don't know, like a big bank. I think like maybe Morgan Stanley. And I like erroneously in the email at reaching out to him put the wrong bank. I put like, I was like, oh, what's it like to work at Morgan Stanley? And he really worked at Lehman Brothers. I don't know. And he like emailed me back basically like, it would be best to proofread your emails best. And then his signature. And I remember being like, well, that's tough. I probably should have proofread that a little bit better, but it just kind of soured me to that all of that like world that like that's how you would treat someone via email. So I kind of circled back around to it. I got a job as a scribe after college and was like, I don't really even know what medicine is. I don't have anyone medical in my family, so I might as well see if I like this, and just kind of went from there. But I don't know. I don't remember a time where I was like, I'm definitely going to be a doctor, but it was always in the background.
I have so many questions for you.
Let's go.
Can we get into some of the questions that we really want to hit you with?
Oh, let's do it, Shrey. Thanks for keeping us on track, host.
Well, all right. I'm going to give you a pretty meaty, tough one. Why is healthcare so freaking expensive?
Oh, man.
Fix it, Colton.
Yeah. I talk about this quite a bit because I think it's fascinating. The way I end up distilling it is, healthcare in America is a for-profit entity. It is, capitalist-based, private for-profit entity. There are hospitals and hospital systems that are privately owned. There's insurance companies that are privately owned, and those companies have shareholders and board members and are interested in their bottom line. And both of those entities exist in between you and your doctor. So like the old school way in like early America is you go to the doctor and it's like a haircut. You pay him $50 and then the doctor gets $50. You know, now if you think about the amount of administrative costs between you getting your care, you know, your company is paying a health insurance company who's hell bent on increasing their profit. So they're going to try to pay out as little as possible. You've got a healthcare conglomerate that is the hospital itself that is also trying to reap as much benefit from the insurance companies as possible. So they have an incentive to up their charges. No one knows what anything really costs. And up until recently, you could pretty much just make up what things cost to charge the insurance company, because the insurance company would come back and say, hey, we're only going to pay you 30% of what you charge us because we know you're up in the cost. And people will go, all right, cool. Well, this is $20 million for this surgery. So give us 30% of that. And so these costs go up and up and up. And in order to combat that, both sides get administrators involved to negotiate these costs back and forth. Well, you got to pay someone an entire year's worth of salary to negotiate on your behalf. And so there was an article, I think within the last 10 years, that talked about how for every doctor in healthcare in America, there's 20 plus administrators.
Wow.
And so when you pay for your healthcare, you're not paying for a doctor to give you healthcare, even though that's the messaging politically and why our pay as doctors hasn't increased in 20 years. We haven't gotten a real money increase in Medicare costs that go towards doctors. What you're really paying for is this enormous for-profit system in between you and your doctor.
A bunch of email writers.
You got a bunch of people with email jobs. Exactly. It all comes back to the email jobs.
I mean, it's not too dissimilar from like universities at this point, where it's like you're going to learn from a professor, but the professors are like less than 10% of the overall administrative staff of a university. And so costs are, $70,000 a year to go to college now. It feels like a really similar bloat to me.
Right. And yet you have people taking online courses because they're like, well, why wouldn't I just listen to lectures from this guy from, I don't know, University of Michigan who does a better job at teaching?
Yeah.
So
and we're looking
like,
at WebMD trying to self-diagnose for the same reason.
Yeah, you have cancer.
That actually brings up a good point, right? Like with resources like WebMD and the internet now, like how often do you know when a patient comes in has been like Googling their face off?
Oh, pretty instantly. I mean, people mispronounce things pretty egregiously. I think the bigger one is that they changed the rules around your access to your own information, and I think rightfully so. So it used to be if you wanted to see your lab results or your imaging, you had to go talk to your doctor. Now through your patient portal, you just get it beamed to you instantly the moment the radiologist reads it. So what these people will see is these reports from their spine, and they'll see a word that really just means a benign finding that doesn't matter, and you just brush it off. Then they Google it and find someone who's got cancer. And so they're coming in like, why hasn't anyone called me? I'm going to die. I'm never going to walk again. And they pronounce these, couple words. I mean, it's pretty obvious, but people get really freaked out, rightfully so. I mean, this is their life and their health. But yeah, it's usually pretty obvious when people have been consulting Dr. Google.
On the flip side, how often are patients lying to you? How often how often are you spotting a fibber?
I assume all the time. I mean, you've been to the doctor, right?
Yeah. Well, before you hopped on, me and Justin were confirming that we both lie to our doctors, and Shrey maintains. So
how much do you tell them you drink? Because they ask.
1 to 2 drinks per week.
Correct. Exactly. Everyone has 1 to 2 drinks per week.
I told my doctor in college, on the checklist or whatever, it was like, are you a light, moderate, heavy drinker? And I was like, I go out and have a good time on the weekends, but I don't really do it too much during the weekday. So I'm like a moderate drinker. And she was like, okay, let's talk about this. Moderate. How many drinks do you have in a week? I'm like, I don't know. I don't really drink during the weekday, but like I'll go out like Friday, Saturday, maybe Thursday, and I'll have like, 10 drinks. And she's like, that is not moderate. You're a very heavy drinker.
Like, who counts their drinks?
Yeah.
Oh.
Just truly now you're chastising your doctor for being a narc.
Yeah, I was
She's like,
"Come
I
on,
don't know,
doc."
man. I'm just trying to help you, but you're not moderate. Yeah. So to answer your question, Travis, I assume everyone to some degree, but usually people won't lie about the same thing if you ask it in a different way 2 or 3 times.
Oh, give us an example.
I mean, for us, like back pain, there's a million passive modalities of back pain treatment. People like getting massage, they like getting chiropractic, they get injections from us, they take medications. These are things that you just do or just like kind of happen to you. But the best evidence for long-term relief of back pain is active treatments. It's physical activity, it's physical therapy, it's changing biomechanics, it's these types of things, right? And so usually what you're trying to push people towards is those things first, see how they do, come back in clinic. Hey, if you're still hurting, come back to me. I've got options. I've got different things I can do to help you feel better. But the number one thing you ask is, well, how's physical therapy been going? And they're like, good. And they're like, oh, what kinds of things have you been working on? And they're like, stretching. And you're like, really? Okay. Usually they kind of do kind of a home exercise routine. Have you developed that yet? And they're like, doc, I haven't been. And you're like, yeah, okay.
You're like, why do you like me?
It's hard to lie 3 times in a row about the same thing. You're eventually like, okay.
You got me.
I'm super curious as somebody who treats backs and spines regularly. Like my YouTube algorithm right now is full of back cracking and like people getting attached to a strap and they get pulled and they're like, oh, like I've seen God. Like, what is your take on alternative medicinal practices like acupuncture, chiropractic? Like how do you feel about those?
Yeah, I mean, this is my world, so I could talk a long time about these things. There's a lot of things that people do that I will say that despite my extensive training for back pain specifically, I don't understand. And yet they will come and tell you about how much it worked and it cured their back pain. The basis for acupuncture is using, meridians and connecting them, and that there's different meridians that connect to different organ systems, and that those you can see how much hand waving I'm doing. Those get out of alignment in some way, and you can kind of try to align them by using these very specific acupuncture needles. And I don't understand how that works. And yet there's some studies out there that show that people get real benefit from this. I don't know how to explain that. Chiropractic, I have to be careful here. There's certainly some very good and knowledgeable chiropractors out there that are doing it the right way. They encourage people to get moving. They encourage people to, change their biomechanics. And they're doing kind of either manipulations or soft tissue massage and things like that help people feel better. Like, why would that ever be a bad thing? The origins of chiropractic care, the kind of godfather of chiropractic care was a guy who believed you could get closer to God by aligning the spine. I've seen a lot of chiropractors that will take x-rays of people, even though they're not qualified to read them, and then tell them that different things are out of alignment. They'll show them different things. You can see it's out of alignment here. And that popping is actually me realigning the spine. I have no evidence to believe that's real at all. And, there are, people will argue this, but I have seen in the hospital, for instance, vertebral artery dissections from people getting cervical manipulations, and they get a massive stroke and are forever changed, for life. And it's not like you can undo that. And there's some evidence that high velocity manipulations in the low back can greatly worsen or induce disc herniations. So I usually try to steer people a little bit away from chiropractic care, but understanding there's very good actors out there that are doing good work. But yeah, that's not one I really believe in too much. But man, there's billions of dollars in back pain. And so everyone's trying to come up with some new technology. And what's really tough is anything that's a pain syndrome, you're basing your research on someone's subjective report of how their pain is. And pain is such a complex emotional experience that proving something relieves pain is really, really difficult. And so I try not to just blindly discount things, but there's things that don't make physiologic sense to me, and it's hard not to, kind of talk shit about some of them.
How do they feel about you? How do
The chiropractors?
feel about doctors?
Oh, I'm sure they think we're idiots and that we don't care and that we're all in the pocket of big pharma and that, we don't really understand how to help people. And, to be fair, pretty awesome to be a chiropractor, give someone a manipulation, and they look you in the eye afterwards and go, I feel better. Like, very rare for doctors to do that.
I want to get your thoughts on this. So, like, are you obliged to just follow like proven studies, research? Because I've heard this thing of let's say acupuncture, because it sounds like chiropractic is maybe a little insane, but like acupuncture may have a place for a given person given their particular circumstances. And so like I've heard the argument of like Western medicine is more like population based. So like a doctor isn't going to give someone a recommendation that hasn't been sort of proven through studies. But there are things, maybe like acupuncture, that could work for one particular individual. So do you agree like there is a place for those things, but like maybe you can't really like fully recommend that given the lack of evidence around it?
Yeah, and it's a really good question, actually. So I think the way you're conceptualizing it is very true. Doctors, I think, or we've been a little off base in general in Western medicine because we look at big data a lot of the times and we try to make sweeping generalizations when in reality, response to treatment is a very individualized response, right? And so just because when you look at 1 million people, no one gets better with acupuncture, it doesn't mean there's not people who get 100% better with acupuncture, and that was the best treatment for them of all the things that we have. So the where you hit pay dirt is kind of how do you identify who those patients are? That's a lot of what we study. Now, I think people make sweeping generalizations about like whether or not there is or is not evidence. A lot of medicine has some but not very good evidence, and that's definitely true in the back pain world. There's a 20-person study out of Minnesota, and all the participants were white middle-aged males, and when we did acupuncture, they all got better. I don't know what to do with that. How generalizable is that? Does that mean there are people in Minnesota that are white males out there that might get better? Yeah. Obviously there's much bigger studies where, those kind of become the gold standard of evidence. But the mantra in medicine is that half of what you learn in medical school by the time you finish your career won't be true. So I think you have to allow yourself to be skeptical while also being very honest with patients that, I don't have either an understanding of how or why that would work, or I don't have any evidence to show you why that would work. But in the case of acupuncture or something like that I don't either understand or have a physiologic basis for, it's also very low risk. And anecdotally, in my experience, some people get relief. So why wouldn't you try it? Because it's also, low cost. I think you just also have to counsel people that, it's a predatory environment out there. There's a lot of people trying to make a buck for people who are desperate and in pain all the time. And, you see a Facebook ad for some crazy back stretcher thing that could relieve all of your pain, and you don't even have to deal with this fucked up medical system. And all of a sudden you're willing to throw down $100. I see people who are spending thousands of dollars a month on supplements that are completely unregulated. And you kind of have to have that conversation. How much do you feel like these are helping you? Is this worth all this money? I don't have any evidence to suggest that these are working. It's tough.
Well, I think that, you're kind of getting also, first of all, it's fascinating. I think like diversity in medical studies is something that we're decades behind on. And
it's a huge problem.
It's crazy when you actually start to look at the numbers. And
yeah,
this is kind of getting to the crux of why we started this episode in the first place. And we might be asking you to do something quite generalized when your answer is quite individual, but we're really interested in men's health because it's, first of all, the only thing we're qualified to talk about as guys, but specifically like what should we be doing to take care of ourselves when there are supplements on the market? People are taking testosterone or replacement hormones, or eating raw organs like the Liver King to stay fit. what is recommended for guys going into their early 30s to stay healthy? And like, where do you see most guys our age dropping the ball when it comes to their own health?
Yeah. I mean, that's a great question. I mean, I think the disclaimer that I need to make pretty openly is that I'm not a men's health expert. I am a man. I am a doctor. So that I feel like that gives me a leg up over the layperson. But, obviously the people who are dealing with this day in and day out are family practice doctors and general medicine and kind of internists. And so that would be if you had an actual concern about yourself, who I would go talk to, I wouldn't talk to me. But I do have a little more, enough knowledge, I feel like, to kind of tackle a little bit of this. I think it's several things. So the testosterone thing is fascinating to me because anytime I start to see cash pay clinics pop up, I get a little skeptical because, yes, it might be working, but why is this kind of outside of typical medicine? Like, why is this operating on the fringe? I feel the same way about some of these ketamine infusion clinics and things like that, where you can go and pay for these treatments in kind of an underregulated fashion. There is a designated range where we know testosterone lives, and it's pretty wide. We also know that testosterone over time does, to some degree, decline, and that's kind of a normal part of aging. And I'll see people who come in on massive doses of supplemental testosterone and, their levels are high. Yeah, exactly. And they're like, I feel great. This changed everything. I was sleepy all the time. I had chronic fatigue. I feel awesome. These treatments are like not without serious considerations for side effects and long-term damage, like steroids and testosterone and these kinds of things have cardiovascular risks, have endocrine risks, you have risk of like forming clots and things like that. And all, so my sense is it probably makes people feel awesome and they're getting in the gym and getting those gains. But man, I think it's more dangerous than people give it credit for. And I wonder in 10 years, once we see this kind of current wave of testosterone supplementation, these people as they age, I do wonder if there's going to be like a long-term consequence.
It's always interesting. Like you'll look at those people who are doing like testosterone replacement today, like you'll see a jacked Jeff Bezos looking like a supervillain on his yacht. I'm like, that looks pretty cool. I'd like to be 60 years old and look like break down a wall. But like you see people who are successful using testosterone, and I feel like nowadays more than ever, like kids are like, oh yeah, I'll do that. I'll take tren. I'll take all these crazy things.
Man. Yeah, that's really scary to me. And obviously it's because I've seen nothing but like, I always joke that the people I treat are having the worst day of their lives and have these catastrophic things happen. But like when you talk about like cardiovascular risk or things like that, I mean, what we're talking about is like having a heart attack or, having when I talk about like blood clot risk, that's like having a stroke or having a pulmonary embolism. We had a friend who was in his 30s recently who passed away from something related to that. Not that he was at all doing testosterone replacement or anything. I think it was essentially a freak accident, but you're playing around with physiology that I feel like I don't understand. So I'm going to assume you don't. And that scares me.
Nah, dude, Reddit told me this is the right one for me to get my gains.
Yeah, exactly. Honestly, yeah, I think because I figured we would talk kind of generally about men's health and what men do and don't do. I don't know. The thing that instantly came to mind was that like people age faster when they kind of start thinking of themselves as old. Like when you stop moving as much, when you stop being active as much, when you start to say, I'm not going to go do that thing because I'm worried I'm going to get hurt, or like my bones aren't what they used to be. Or, I knew a guy who started playing rec league and he instantly tore his ACL. So I should probably stay on the couch. What I see is typically that's when things start to really break down, because I think, motion is lotion for the joints, and you feeling old is probably because if you think about your day-to-day life compared to when you were in college in your early 20s, I think about mine, I was probably, 10% or something crazy as active as I was then. And I also think that like a lot for dudes, especially, it's those active things where we have like community and you're getting out and seeking friendships and being active in these social environments and things. And I don't know. I think for dudes in their 30s, it's dealing with mental health is every bit as big, probably bigger than any other physical thing. Like, what are you trying to combat by taking that steroid or taking that testosterone replacement? You're like, well, I feel tired all the time and I feel like I don't have motivation. And I feel like, when you're kind of really just describing depression, which I think is something we don't talk about. But I mean, I just wonder how many guys are treating their depression with testosterone replacement therapy.
How far are we willing to go to not talk about our feelings? Well, it's an interesting point because, like, even Shrey, you and I have talked a little bit about, like, you're a basketball guy, you've played basketball your whole life, but more recently in the past couple of years, it's like the perceived risks of going into a pickup game and having a serious injury outweigh the benefits of, like, the exercise and a little bit of that community. And that's like a weird trade-off that I feel like I'm starting to make more in my 30s of, like, ooh, is skiing worth it this year because 3 friends tore their ACLs? Like, it's a weird calculus.
Yeah, the thing you just said, Colton, about not wanting to do activity, I literally came to that conclusion maybe in the last 6 months with basketball. Like, I'm never gonna play this again competitively because I just feel like I'm gonna get hurt.
Yeah. And
so guess I'm on the decline.
You're giving yourself old man body, Shrey. What are you doing?
Yeah, dude, motion is lotion. Get back in.
That's a great tagline. Like, we got to start using that.
I don't know, man. Like, I started playing hockey with Jake. Like I told you guys, there's guys on the ice. Like, it's a hockey thing that you just don't stop playing. These guys never stop playing. Eventually they stop letting young guys in your league and you have like an over 40 or an over 50 league, which is totally fair. But like, I'm regularly out there and we'll skate by a guy and be like, you are definitely picking up like Medicare checks. Like, you are old enough that you could be my granddad. And I don't know. I think that mentality is a lot more right. And I think a lot of times when people get like these scary stories about injury, it's because you've already kind of ramped down your activity. So of course, if you go from the couch to full court pickup with college level players, yeah, you might tear that ACL. But like, that's probably more indicative of what you've been doing than it is the inherent risk of the activity is so much more now that you're 30 instead of 25.
So what you're saying is I need to hoop 2 hours a day.
Yeah.
Well, I mean, like, yeah.
All right, got it.
I mean, it is funny. I think with the caveat that like you have to ease into the things that you used to be really
of
like.
Course.
There was this guy.
And, exactly.
We were in Arizona for a Ravens game with me and my sister traveling out there, and everyone's drinking before the game, right? And it's all these middle-aged people, and they have a little course outside of the stadium that has like 100-yard dash that you can time yourself in. And one of the dudes just immediately tears his hamstring, like going for a 100-yard dash. And this is like, he's in shape, but this man has not sprinted in probably 2 decades, right? And it's just like, you can't be doing that, I feel like.
Man, when was the last time you guys were at a full sprint?
I was chasing down a mystery cab in China trying to find a white person. We had gotten to Beijing, and like obviously our phones don't work out there. And one of my friends, Mike, who's like the whitest dude of all time, is landing in Beijing. His phone doesn't work, and we just say, "Mike, meet us here." And it's just a random Chinese street sign in the middle of Beijing. And like, I don't know anything besides that. So we lose him, and all of a sudden I see a cab pass by with like a Yankees hat and a white guy in the back seat. So I just fucking take off into the smog.
Did you catch him?
Yeah, I ran a 4.3. That's by the last time.
Maybe all of this advice is not landing and you guys have just maintained your freak athleticism this whole time.
Obviously.
Yeah, clearly.
Yeah.
Okay, apart from the avoiding testosterone and staying active, like what are the other things guys should do to stay physically or mentally healthy?
Yeah, I feel like people are going to laugh if they ever listen to this and know me, but I feel like getting good sleep is pretty important. And yet like medical training and just my general outlook is to not go to bed when you could do another activity. But I feel like sleep, I mean, there's a reason that like it's a cliche that doctors are always talking about diet, exercise, sleep, and these types of things. Like you can't be healthy if you don't give your body good fuel. You can't be healthy if you don't allow your body to like recuperate at night. And the reality is there's way more long-term effects of bad sleep than we probably ever realized. There's the thought that you're clearing some kind of, neurotoxic chemicals, and that you might not get Alzheimer's if you, sleep better, at our age. There's all kinds of evidence that, cholesterol is, being laid down in your blood vessels when you're in your teenage years. And so it's not just hitting 30, gaining 15 pounds, looking down at yourself and going, well, I should mix in a salad. It's probably like long-term choices throughout your life. But, generally speaking, I always tell people in clinic, if I had a pill that could prove the benefits of regular exercise, then it would be the most efficacious and best-selling pill in America for pretty much everything. But it's hard, and people don't have time, and sometimes it kind of sucks. But that's really honestly the best advice.
Emails. Should we do a little mailbag from the boys?
Let's do it.
Yes.
Colton, the impetus for this is we asked a bunch of guys in our friend group, many friend groups, to ask anonymous questions about their health to a doctor.
Oh, fantastic.
We've accumulated. So we're going to put you out of your comfort zone because there's probably not real answers to most of these. But
right. So that tagline I had about not using this as real medical advice, you're now going to give me people who are going to use this as real medical advice.
Yes.
That's perfect. Yeah, great.
Yeah, but they're anonymous. So
they're anonymous. Yeah.
Perfect.
So
can we, once the podcast is over, can we de-identify?
Yes. I mean,
right,
obviously not. I can kick it off. Long-time listener, first-time caller. With the colder weather, I'm concerned with testicular torsion. Should I be worried at all, and are there ways to mitigate the cold's effect on my balls? Also, especially if my apartment isn't heated, what are some ways to deal maybe with the body image issues associated with polar penis?
Wow, that's a banger to start. How do I even attack this? So real physiology here. Your testicles need a certain temperature for adequate spermatogenesis, right? So there's actually, you have a cremaster muscle that's actually responsible for raising and lowering your testicles. And so there is some degree of kind of like up and down to try to keep your testicles at this like perfect temperature, which I feel like is why whenever it's really cold outside, you see guys with both their hands down their pants. So I would just say, let it ride. Your testicles are doing the work for you, buddy. You don't need to make any changes. I don't know what to tell you for the grower, not a shower problem.
Yeah, Valentine's Day is coming up. No heat on the apartment. What do you tell this guy? He's trying to do a good job.
Got a cold dick.
Yeah, I got nothing, boys. I'm so sorry.
Why do your balls shrink up when you jump in the pool?
It's the same thing. They're trying to go towards your internal temperature. Like they're more outside, right? So it's cold. And your testicles are like, no, I got to make sperm at this perfect temperature. So they go up inside you so that they can stay warm.
Honestly, the hardest working part of the body, like no days off.
Yeah. Dude, nothing explains the rise and grind mentality like testicles. They're just out here working every day.
I got a question for you.
Like you personally, or
no, from this anonymous list here that I definitely didn't write first, my personal self. How many buttholes have you touched?
Oh man. Part of the spinal cord injury exam is a rectal exam. It's the most distal part of the spinal cord. And so if you want to give someone a prognosis of whether they'll walk again or how bad their cord injury is, that's a fundamental part of the exam. And a lot of people argue the most important.
Wait.
Well,
Let me get this straight.
You gotta stick a finger up there to see how their back feels.
No. Like this is someone who has a spinal cord injury.
Can you feel a cord through someone's butt?
you're not feeling the spinal cord. So the most distal, or the furthest down part of the spinal cord, controls your bowels and your bladder. And so it's basically those nerves go to the muscles that control your sphincters in your anus. And so you're basically testing to see if they can feel your finger, testing to see if they can circumferentially push around your finger. There's a reflex called the bulbocavernosus reflex, which is essentially that reflex. Reflex arcs are basically nerve arcs that don't go back to the brain. So in other words, if you put your hand on a hot stove, you don't want your brain to have to process that. You just want your spinal cord to instantly send it back so that you take your hand off. So there's a bulbocavernosus reflex. It's a similar one where if you pinch the glands of someone's penis, which is the head, then they reflexively contract their sphincter. So you test that to see if that reflex arc is in. And that's part of the fundamental spinal cord exam. I mean, I probably ballpark 100, probably
So
more. Probably
you've been
more.
sticking fingers up people's butts and then telling them they can't walk again?
That's my life. Yeah.
That's
What a
crazy.
bad day.
Oh, dude, and you went to school for 7 years to do that?
Well, what? Do you want your plumber doing it for you?
They clear pipes. I mean, that's their
Out of
job.
all the jobs.
I don't know why I'm attacking plumbers. Sorry for the plumbers
What-
out there.
How do you, this is like not a funny mailbag question, but like, how do you mentally compartmentalize things that like 99.9% of the population would like be forever traumatized about, but you do them 5 times a day?
Yeah, I think it's tough sometimes. I think this is why people tend to have medical friends. For me, it's actually more helpful to have less medical friends, and most of my friends here are not residents and medical people, because it kind of creates like a sharp divide. Like I don't talk about work to any of my friends. I don't know. I don't really have an answer for that. I think it's kind of quickly thrust upon you intern year, especially for us graduating in the pandemic and talking about all this horrible shit, that you just kind of have to create a divide. I think PM&R doctors really interesting. Some of them just become incredibly risk averse because, took care of a girl who had a spinal cord injury because she fell out of bed. So it's like, if that's the threshold, then some people would say, well, I'm not doing anything ever. I'm covering myself in bubble wrap. And then I think there's another sect that are a little bit more like me that just kind of like go the opposite direction. It's like, well, anything bad could happen at any time, so might as well mountain bike and ski and do fun things.
You're like, but have you tried playing hockey?
Yeah. I really did not tell many people about
Well, okay. Here's a conversational grenade. It actually might be easier, but if somebody was sick or hurt on an airplane and asked if there was a doctor on board, would you respond right away? And would you have to?
You're covered. People talk about the Hippocratic Oath, right? You like take an oath to help people. The true Hippocratic Oath apparently has something in it about like not allowing sin into your house. So I feel like a lot of people quote the Hippocratic Oath, but haven't ever actually read it, myself included. I don't think I've really read the whole thing since my white coat ceremony. I would definitely respond. Being a resident, even though I'm at the tail end of my training, I would obviously defer to a doctor's board certified or an attending level physician. But no, I would respond. A lot of flight care. There's a ground-based medical crew that's, as far as I know, a national-based thing. So really, you're just doing like very basic stabilization of people and basically trying to talk through with the ground-based medical crew of whether or not you need to land the plane, as far as I've looked into it. And they've got like a medical kit that, if someone's having a heart attack, you'll have them chew an aspirin. You can take a blood pressure. But most of the time, if I'm scared, I'm going to say land the plane. So I would respond for sure. But
would you think about it?
I might give it a 5 count and make sure there's not someone more qualified.
Could you land a plane, a commercial aircraft, with minimal instructions?
Could I?
Yeah.
Don't those things fly themselves?
That's what they tell
Thank
me.
you. Thank you.
But there
Yeah,
is a
suck
big
it,
thing.
Suck it, Anisha.
Who was that neurosurgeon who ran for president? Is it Ben Carson?
Ben Carson.
Yeah.
Yeah. There's a lot of talk about him because like he's a neurosurgeon, right? So he's like the pinnacle of these like highly trained surgeons. But there's this kind of I don't know how to put it, like a false notion that when you're really good at one thing, you're also all of a sudden know everything about everything else.
Like Ben Carson is the former Secretary of Housing and Urban Development. I don't know what neurosurgery has to do with affordable housing.
Yeah, so I feel like that's kind of the definition of me being like, well, I'm a doctor, so I could land a plane.
Why do so many doctors think they can fly planes?
That's such a good question. I have no idea, but I already know like 3 people who want to get their private pilot's license.
Do you think?
I don't know.
Complex.
Maybe it's because like you got to study a bunch, and we're just professional test takers. People are like, oh, it seems easy.
Yeah.
Or maybe it's that like you don't have any choices your entire medical training, and you just get told where to go. So people are like, I want to decide where I'm going to fly today.
Through heavily regulated airspace.
Yeah, I'm going to fly over the Pentagon.
I have a question from one of our listeners. Is there any downside to jerking off?
Is there any downside to jerking off?
I'm reading the things, man.
Not that I'm aware of. Smoke them if you got them. Okay, I actually did read an article that was put out by NPR, came on my Google News feed. But apparently, like,
targeted.
Yeah, I guess so. But apparently, like, not masturbating is like a trend. Like, semen retention. Is it a thing?
I mean, I've heard that before, that like in some sense that if you're just leaving around your old swimmers, that they, by the time you get rid of them, they might be swimming sideways. So like regular ejaculation might be better for fertility, but I'm not a fertility doc. But I have heard that. But how regular? I don't know. I don't know what the dosage is, you know?
Motion is the lotion of life. I think that's the answer.
Dude,
again.
sometimes lotion is lotion.
I got another one. How much longer am I going to live now that I sun my perineum and tap into the mycelium network every day?
Oh, this is such a good question. I mean, everyone that I've ever checked a vitamin D level on is deficient. So there you go. We should probably all be taking a little vitamin D, especially you indoor New Yorkers. Do you guys even see sun? Like, does the sun get between the buildings?
What's that?
Yeah.
Sun?
Yeah.
Sun.
Yeah.
Wishy.
Uh-huh.
I love lamp. Lamp is sun.
So, will you live forever now that you're sunning your perineum? You're well on your way, good friend. You're well on your way.
Excellent.
It's also perineum.
Thank you.
But people have been saying perineum a lot lately.
I do have
the parent.
Go ahead.
The perineum might be having its day. It's not a word that came up in casual conversation until the last couple of years, and now people are dropping perineum all the time.
Are they?
Is that just our particular group of friends?
Maybe. I also think it had other words, and people just learned the medical word for it.
Yeah.
What is a medical word that people always mispronounce that just like drives you insane?
That is a good question. Oh, nobody gets rotator cuff.
What do you mean?
Like your shoulder, your rotator cuff. People
people
call it the rotor cup.
What?
Cuff is not, they're just like, it's not a cuff, it's a cup. I just feel like I've heard a million. And then people really struggle with prostate. A lot of people saying prostrate. Those are probably the biggest two that I see like day to day.
Huh.
I'm also at the VA, so everyone who served in the Vietnam era has problems with their prostrate and their rotor cup.
What is the most overrated type of doctor, and what's the most underrated type of doctor?
Most overrated and most underrated. I mean, most underrated by far is pathology because no one even talks about them.
What is it?
Pathologists are the ones who are like basically most of the diagnoses that are happening in the hospital are pathology based. These are the people that run the labs that when you get blood taken, they're analyzing it. These are the people that when you do biopsies and they're trying to figure out what type of cancer you have and whether or not it's spread. I mean, massive medical decisions are based on these people who, you know, are not patient facing. So they work down in a lab and they are just like these brilliant doctors who have medical training, but also have like deep laboratory science knowledge. And I feel like most people have been diagnosed if they ever have a, you know, significant disease process in part by a pathologist, even though they'll never know that or never meet them. So that's probably the most underrated. Overrated? That's a good one. They're clearly not.
You know.
Let it out.
I mean, this is just a personal vendetta, which is that like I've really never met an OBGYN doc that I liked ever.
Oh.
Perfect for the men's health episode.
Yep.
What was funny about that rotation is I overall enjoyed it. It was probably one of my most enjoyable actual like doing medicine rotations in medical school. It's like it's an amazing like field. You're helping people give birth. You're like primary care doctor for women's health issues. You're a surgeon. You're seeing people in clinic. You just like basically your OBGYN doc is like, I got you. I can do anything. But man, they were a toxic bunch, at least in my residency or my medical school.
Jeez.
Which set of doctors is the biggest demons?
Probably orthopedic surgeons.
Ooh.
Why is that?
They like revel in the fact that they don't know anything except bones. Like you try to talk to them about any like things that obviously any basic med student can understand. And they're like, bro, that sounds like not bones. That's probably, you should talk to that other doctor. And I'm like, come on, dude. Like, can you just like help me out here? Just like, how old are they? And they're like, broken femur. So we should probably fix that.
Kind of love that.
Orthopedic surgeons have published studies about how bad they are at taking care of patients in the hospital. Because what they wanted to do was have internal medicine docs be their primary. So they would take the call like in the middle of the night, the patient needs more pain meds or whatever. So that way they can just do the surgery and then hand them off. And they published their own studies trying to prove that they were bad doctors inside the hospital.
I respect that.
It's hilarious. I mean, It's awesome.
They were staying in their lane.
Yeah. Colton, when do you think tipping culture?
True.
When do you think tipping culture is going to come into medicine? Like, should we be tipping our nurses and doctors? And if so, what percentage?
Dude, not soon enough. And I'd set the little kiosk to start at 30%. You know, like you want less than that, you're gonna have to push the custom button. You're gonna have to type in some numbers. I'm just gonna be staring at you while you do it. Yeah, that would be great.
On the $20 million surgery.
Yeah.
Guess I got to tip 30. I do have a serious question for you.
Man,
what is the biggest dick you've ever seen?
Don't know how to answer that.
Say when.
Tell us when.
Stop putting your hands up, John.
Dude, this is huge. This is crazy.
You haven't said when?
Dude, this is unreal.
That's impossible.
This is wild.
That's unlimited pepper at Olive Garden that you just asked for. You never said stop.
Sure, your questions are hard hitting, man. I wasn't ready.
Was it big in terms of length or girth? Because I hear girth is what really matters.
To who?
To the ladies.
I'm clipping that.
Yeah.
That's very.
That's not one of your medical studies, is it?
I could argue that it's a little heteronormative, personally.
That's fair. Get better, Shrey. Be better.
A follow up to that: is poop actually sterile? And if so, why is poop?
Oh, Yeah, actually, great question, because they used to teach that urine was sterile, and it's definitely not sterile. There is a inherent microbiome in your bladder, and the thought is that gets tipped off with different antibiotics and with catheters and things, and that's why people get bladder infections, especially people with spinal cord injuries and stuff like that. So no, urine is not sterile. And then your feces aren't sterile. It's the literal opposite of sterile. It's teeming with bacteria, a lot of which is good, but like the worst thing you can do is get an infection with gut flora, because it's like harder to treat and very virulent and all these things. So you'll see certain types of infections. This is you okay with a little medical TMI here?
Oh boy.
Let's do it.
People that have spinal cord injuries, they lay in bed all day. You'll get certain types of infections where their skin breaks down and they get a wound. And then because they can't tell when it's time to poop, that wound will get contaminated with feces. And you can often tell when you culture their blood when they get really sick by the certain bacteria. Oh, this probably came from their poop.
Damn.
That's gross, dude.
I actually took care of a patient once who got sick because, and we found out what did it, because when we cultured his blood, he came out with Pasteurella, which is typically only found in dogs' mouths. And we asked him, and he was like, yeah, I woke up and my dog was licking my surgical wound.
Ooh.
Dude, that's some Dr. House stuff.
I mean,
that's
he was
some wild shit.
Yeah.
Who's your favorite doctor of all time?
Yeah.
Name your starting 5 favorite doctor.
Like starting lineup?
Yeah. So who's playing point guard?
All right. So let's pick some real down the middle, not controversial figures. So let's point guard, Dr. Fauci.
He's small. He's like point guard size.
He's small.
He's scrappy.
He's like all fundamental.
Really? Do you think he's not on TRT?
He's New York strong.
Yeah.
Well, like kind of wiry.
All right. So we got Fauci at point. Let's round out this.
Yeah. No, that I don't really idolize many doctors. I don't even know. Man.
Name a female doctor, Colton. Name one female doctor.
I mean, can I name all of the female doctors that I work with?
Can you?
Yeah.
Are you trying to Billy on the street me with name a woman?
Yeah.
I haven't heard a name, so.
God.
Yeah. You're thinking for a long time.
To name a female doctor?
Yeah, just one.
Dr. Adele Miron.
That's
one of our
up.
program directors.
Yeah.
That's fucking fake.
Yep, you can look it up.
Might as well Dr. Pepper us right now.
So, this really does not feel like men supporting men on the men's health episode where you're yelling at me to name a female doctor. I mean, what women are you trying to win over at this point? Like, it's a men's health episode and we're just chopping it up about penises.
We lost them hours ago on this topic.
Yeah. Who are you virtue signaling at this point?
Should dudes get circumcised?
That's a great question. And actually, have you guys listened to the Daniel Tosh podcast?
No.
No.
He interviewed his wife's gynecologist, which is pretty hilarious.
Wow.
There's currently no medical recommendation for circumcision. It's purely a preference thing. There was previously thought that it reduced chances of certain infections because it was easier to clean if you were circumcised. I don't think that's really borne out. And I know there's certain considerations for like sexual health with or without circumcision. But what this OBGYN was talking about was how like used to be at the OB-GYN conventions, there was huge crowds of people who were, pro and anti-abortion. And apparently in recent years, it's the pro and anti-circumcision crowds that are like even bigger, which is just kind of hilarious. Feels like, a Also, there was that Arrested Development episode where she was picketing for hands off our penises. Pretty hilarious.
Can't imagine that like that becoming someone's life calling, just saving foreskin.
Yeah. How would you measure? Would you measure it by number of foreskins saved or like amount?
By the yard.
Yeah.
Yeah.
Cubits.
Oh,
I guess in Europe you'd use the metric system.
yeah. Boys, I think we might have exhausted our mailbag here. We might have thrown everything we had at Colton.
Do you have any questions for us?
Why did I do this interview?
Well, I'm so interested as to like, because I haven't heard the precursor episode where you guys apparently talked about some of this. I'm so interested to know what you guys were talking about.
I don't think we double dipped much
No.
across the episodes.
All right. Well, thanks, Colton, for joining us for a very special episode of Ask a Doctor. Yeah, follow us on TikTok, Instagram, Spotify, YouTube. Smash those like buttons. And yeah, take it easy, everyone.
Tip your doctors.
Peace.
Kiss the homies goodnight.